You're listening to episode 57 of A Whole New You podcast. On today's show, I'm interviewing naturopathic physician Dr. Jannine Krause about neuroinflammation, a sneaky form of inflammation that many of us may be experiencing without realizing it. Dr. Krause discusses the symptoms associated with neuroinflammation, its causes, and effective treatment protocols. This is definitely an episode to tune into because Dr. Krause gives us all ways to reduce inflammation in our bodies so that we can live optimally healthy lives. Welcome to A Whole New You podcast. I'm your co-host, Kim Maravich. I'm a registered nurse and author of the book 360 Health. I'm joined by my dear friend, Lori Biddle, a health and wellness coach certified through the Institute for Integrative Nutrition. Our show exists to inspire and empower women to take charge of their health with weekly tips and conversation about self-care, mindset, nutrition, fitness, and clean living. Please keep in mind that the material provided in this podcast is intended as general information only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. We're thrilled to have you here. Let's get to the show. Before we get to the show, I'd like to read a 5-star review that we received through iTunes. This is from Mindful in the Muddle, and it's titled Such a Great Podcast. Kim and Lori talk about a great variety of topics. There is something that everyone can relate to and learn from in each one. Kim and Lori are so down to earth, and so are their guests. I always look forward to listening to their podcast. Thank you so much for leaving this review. It means so much to us. Reviews and subscribers help boost our rankings in iTunes, and they help people find our show who might not already know about it. If you're listening right now, why don't you pause the show and head over to iTunes? There's a clickable link in the show notes. You can subscribe there and also leave us a rating and review. If you do, we'll be sure to read your review on a future episode. Now let's get to the show. Welcome back, everybody. Today I am pleased to be interviewing Dr. Jannine Krause. Dr. Krause is a naturopathic doctor and acupuncturist who specializes in anti-aging medicine by helping her patients improve their health and reverse the signs of aging by focusing on nutrition, mobility, and stress reduction. Dr. Krause's unique approach to wellness is simplifying natural medicine and healthy habit formation. She believes that health starts with what we eat, how we move, and how well we manage stress. She wants to help prevent little health issues from becoming big ones down the road. She's committed to slowing down the aging process and wants to help others with this too. There's a lot of health information available out there, and she's here to help people focus on what's important and sustainable for them. She is also the podcast host of The Health Fix, where she is dedicated to empowering people to take charge of their own health. Dr. Krause, welcome to the show.
Thank you, Kim. I appreciate it.
Yeah, so good to have you here. And I love your mission of empowering others because that's our mission as well. And really, the whole aging process. I think that's one that we all worry about down the road. But I think you have an approach that helps us kind of take that into our own hands. That we don't have to be just a victim of the aging process. There are ways to slow it down and to become better versions of ourselves as we age too.
Absolutely.
Yeah. So, Dr. Krause, before we get to asking some questions, could you just tell us a little bit more about yourself, maybe where you live and your practice?
Sure. So I am currently in Tacoma, Washington. Been here about 6 years. I grew up in the Chicago area, a little bit north of Chicago. And so practiced a little bit there, practiced a little bit in Colorado. And so I'm going on my 13th year of practicing and finding that really we've got a population of folks that are struggling to weed out what they need to do to help keep themselves healthy. And so instead, they're having paralysis by overload of information. So my job is to help simplify things. And so here at my practice in Tacoma, I am doing acupuncture and naturopathic medicine at the same time for a lot of folks and working on gathering information and seeing what works in my office, what works with my fellow colleagues, and bringing it to light on my podcast, The Health Fix.
Wow, that's amazing because I mean, you really people can come to you for all sorts of things, right? Acupuncture and medicine. But I just want to touch on something you said about the paralysis, because we are overloaded with information. There's so much information out there, whether it's from just the media or magazines or podcasts, and it's hard to kind of determine sometimes what can best fit our needs. And I know that your approach that you cater to individual needs too. That, you know, sometimes like we talk about like a band-aid approach and just like it's one size fits all, but that's really not the case. And that's what something that I really love about functional medicine, about what you're doing, is that you help each individual and you can give them tangible tips to help improve their lives.
Absolutely, absolutely. I mean, this is not a one size fits all universe. Unfortunately, there's a
Mhm.
lot of blanket information, blanket coaching programs, things of that nature. And I just went to a training this weekend, and Dr. John Russing just kept saying over and over again, it is one size fits one. And if
Mm,
we can get folks to pay attention a little bit more to themselves and what's going on in themselves versus following all the shiny, new things
yes,
online, it can make a huge difference.
absolutely right. So I've been able to listen to a few of the episodes on your podcast, and I would really encourage our listeners to tune in as well because you have so much very good information. And as we spoke before we started recording, you do have a practice, and so that you're not just taking theory and talking about it on your show, you're actually bringing information from people that you've treated in your own practice. And one of the topics that I did hear you speak about on your podcast that was so interesting to me, and I don't think it's something that we know about, you know, in layman's terms anyway, is the topic of neuroinflammation. So, could you explain what that is for all of our listeners?
Sure, sure. Neuroinflammation sounds kind of like a big, crazy, scary word, but really it's just inflammation that's like literally occurring in the nerves, in the nervous system. So, meaning your fight or flight response, your ability to calm yourself, but also occurring in your brain. I mean, we live in a very high paced, lots of things coming at us every single day type of environment. And we're really, for the lack of better terms, stuck in sympathetic tone, meaning we're stuck in fight or flight. So, neuroinflammation is an inflammation factor where we are getting inflamed, much like a joint would become inflamed, because I think a lot of people can identify with, oh, my knee hurts, it's inflamed,
Mhm.
or they've got somewhere that's swollen and inflamed. Your nerves can have the same exact thing happen to them based on what you eat, how well you rest, if you're sleeping, if you're stressed out, if you've had traumas. All kinds of things can compact and compound to create neuroinflammation.
Hmm. So, what would some of the signs and symptoms be if we're not sure if we have this?
Sure. So the real obvious signs for a lot of folks would be nerve pain. So something called neuropathy, numbness,
Mhm.
tingling. You could also have strange sensations. Sometimes folks will say, "Well, this one part of my leg feels like there's ants crawling." Much like if you sat on your leg
Mm,
for too long and you got up and things started tingling, it would be similar
mhm,
to that. Or sometimes folks will talk about hot and cold differences. One leg it feels hotter than the other, sweating, things of that nature. Now, other signs of neuroinflammation that we don't necessarily relate to an inflamed brain would be anxiety,
mhm,
depression, anger, irritability, but then also gut issues. A lot of what we've thrown into the bucket of IBS, irritable bowel syndrome, is nerve inflammation. Your nerves that go to your gut are inflamed, maybe because of too much processed foods, or maybe because you're not digesting well. You've got chronic diarrhea, you've got constipation. It could be a whole bunch of different things. Maybe you have food sensitivities. All of these things can play out in causing neural inflammation.
So you've mentioned a few things that I was jotting down as you were talking. So it seems like it can be caused by many different factors. Would you be able to outline? You did mention some of the things like food and trauma,
Mhm.
but could you like kind of break that down a little bit more specifically? What are you seeing as being kind of root causes of neuroinflammation?
Number one is the gut. If someone has something called leaky gut, you guys talked about that on the podcast
Yes,
at all?
we
Okay.
have. Yes.
So for those of you who are just joining in and not familiar with leaky gut is when we have gut lining inflammation and the cells are irritated, they degrade a little bit, and so we end up getting food molecules, chemicals, etc., going across into your bloodstream. Then your immune system has to figure out what to do with these molecules that they've not seen before. So we create an immune system reaction. All of the nerves surrounding your digestive system are subject to being inflamed when you have a leaky gut. In particular, we have a very extensive nervous system around our gut called the enteric nervous system. If you want to geek out on that, you could geek on that for days.
Mhm.
But once we start getting the immune system response happening in the bloodstream just outside of the digestive system, that same kind of response is going to happen at the blood brain barrier. Your blood brain barrier, meaning what gets across from your bloodstream into your brain, can also be compromised. So most folks who have something called leaky gut also have a leaky brain, as I call it. So in my practice, what I'm seeing is folks are having trouble digesting foods. So they might have diarrhea, they might have constipation, they might have chronic gas or bloating, something of that nature, acid reflux, food sensitivities, or collecting food sensitivities, as I call it. Because I think for a lot of people come in the practice and they're like, hey, doc, I have been noticing I can't really eat a lot of the foods I used to, or I can't drink wine anymore. What's up with that?
Mhm.
Most of the time I'm like, well, that's good, but that's not the story. So we have that happening, but at the same time, they're like, I'm becoming more irritable. I'm snapping at the kids. I can't sleep. I'm anxious. I just can't seem to shut my brain off. Or we have the other spectrum of things going in terms of folks saying, hey, doc, I eat some foods and like right after it, I'm so sleepy. And then I get
Mhm.
so sad and I just can't seem to get out of that funk. I don't know what food it is. I don't know what's happening, but it seems like I just can't get out of a funk. And I've tried all these antidepressants and nothing's working. What do you think's going on? And so that's where I'm thinking, oh, we've got a leaky blood brain barrier in addition to a leaky gut. So those would be the two areas that I see neural inflammation really causing trouble in general.
Okay. So, just explain that maybe to me and to our listeners a little bit. So there is a connection between leaky gut, intestinal permeability, and the leaky blood-brain barrier. How does that occur? That there's like this connection that's so we're going from the intestines, and then because I don't think we're thinking about like how that can affect our brain. Can you explain that a little bit for
Absolutely.
us? Okay.
So we get molecules. Let's go with glyphosate. So this is Roundup.
Hmm.
It
Hmm.
is a chemical that is put on a lot. It's a pesticide that's put on a lot of our produce here to grow and keep the bugs away and keep the weeds away. And in particular, it's commonly used with wheat. So
Okay.
we eat something that has wheat in it. Let's go with we just got a nice baguette that's super warm, just came right out of the oven. You slap some butter on that sucker and you fight to not eat the whole thing. So you get that guy in and it sits in your belly like a rock. And you're going, oh man, I probably shouldn't have ate that. Well, what's happening is your body's starting to digest the gluten and it's starting
Mhm.
to digest the molecules of wheat to actually get the gluten out. The gluten's going to stick to the gut lining, it's going to irritate it. Now, fast forward, say you've had like 20 days where you've made your homemade baguette recipe and you've just done the same thing, even though you're like, I kind of don't feel so good. And it seems to get worse each time. Well, that gluten molecule is going to get into the bloodstream and your body's going to create an immune system reaction to that gluten. And it's going to keep doing that over time as you keep eating the same food that has now provoked a leaky gut situation. In that wheat, say you didn't get organic wheat, you didn't get sprouted wheat, you didn't get like the cleanest einkorn wheat in the universe. Let's go with a generic all purpose flour that you made your baguette out of. Well, you're going to have glyphosate in it. You're going to have a little bit of pesticide in there. And now, when your body's reacting to that gluten, it's also getting glyphosate, the chemical, the pesticide, into the bloodstream. And now the body's going, I don't know what to do with this thing. This is a chemical. So we get an immune system reaction to the glyphosate. That goes through our bloodstream all the way up to the brain eventually. Doesn't happen immediately. We've got the whole circulatory system to pass through. But more and more exposure of the blood-brain barrier to chemicals causes irritation on that lining, because the lining of the blood-brain barrier is very similar to the gut lining on the basis form of it. There's a lot more complication to it in terms of it. If you're a doctor out there and you're hearing me say this, there's more to it, we know. I'm not going into that. But the basis of the lining is very similar and can be degraded much like the gut. So if you think about synchronous in terms of structure, gut lining, very similar to blood brain barrier. So that is how it gets degraded. It's just being inundated by the molecules, chemicals, things that have gotten across already into the bloodstream. We've created immune system reactions to it that will then end up irritating blood brain barrier, because once we've created an immune system reaction, meaning we've created an antibody to things like gluten, to things like glyphosate, if that lodges by the blood brain barrier, there's going to be an immune system reaction there. Our body is primed to kill and neutralize things, and kill over and over again, and then neutralize it, meaning stopping the inflammation. But if you keep giving yourself things that cause irritation and cause the immune system to be hyperactive, you're eventually going to not have that regulatory system anymore. And that's when the gut and the blood brain barrier degrade.
Thank you for that explanation. So you did mention gluten. You mentioned glyphosate, which just probably our listeners can understand that would be present in a lot of foods that are not non-GMO. That's what is used in as the pesticides to treat produce and things like that. So I would assume it's important to make sure that we're buying organic, especially in those things that are considered the dirty dozen list. But before we kind of talk about some other things, I want to focus on diet for a minute.
Mhm.
So I think that there's our listeners are pretty savvy, and there's a lot of information out there about gluten. You did mention gluten. I myself am gluten free, but you're talking about how the proteins in gluten can actually destroy our intestinal lining. So it's not just that it might not be organic, and this is not just fluff science. This is an actual thing that can happen in our bodies. So besides avoiding gluten and products that are not non-GMO, what are some other things that you think that we need to be avoiding in our diet to make sure that we're keeping that gut integrity?
Oh boy, how long do you have to do? All right, ready, set, go. If we categorize it and we simplify it, because obviously
Mhm.
neuroinflammation is one of my more complex topics. So,
Sure, sure.
to simplify what inflames the gut, I'm going to use categories, and I'm going to use a
Okay.
little bit of common sense. Probably everyone out there has heard that if you can't pronounce it, you probably shouldn't eat it. And that's
Mhm.
true. In particular, things like monosodium glutamate. Glutamate builds up in the brain, and if you've got a leaky blood brain barrier and a leaky gut, you're going to get a lot of anger and irritability. And a lot of people forget about MSG because they're like, oh, my Asian restaurant says that they don't use MSG, and they think that's the only place that you're getting MSG from. I encourage all of you right now, if you suffer with anger, irritability, anxiety, go into your cabinet. If you have any spice packets, like
Mm,
ranch dressing spice packets or things of that nature, read those suckers. And you're going to find some versions of monosodium glutamate. You might see disodium glutamate. It's just creative wording to get that flavoring component in. But
mm,
that's one of the most neurotoxic ingredients out there. So
mm,
are artificial flavorings, artificial colorings, so dyes, and
mm,
natural flavorings. This bugs
mm,
me to the cows come home, that we can have things that are organic and then it's going to say organic natural flavors. That could
mm.
mean so many different things. Over,
Yeah,
I heard once a stat that it was like over 100 different chemicals could be in that natural flavor to get whatever flavor they're going after. And what
that's
I'm
scary.
finding, yeah, it's disturbing. And
Mhm,
people are like, oh, I'm buying my organic bubbly water. I just
mm.
try to keep brands out of things, but you go to Whole Foods, you get your organic bubbly water, and you read the label, and it says organic natural flavors. because you wanted a lime flavor. Well, how many chemicals does it take to create a lime flavor? They could be organic, but these types of things are irritants because your body's like, I don't know what that is. If you eat a
Mm.
lime, it knows what that is. But if you have chemicals that are synthetically processed, your body doesn't know what to do with that. So, number one, making sure you're reading labels. I know sometimes it can be easy to get lazy on it, and it can sometimes be easy to think, oh, it's all organic, no big deal. Read it, read again, because there's some really creative things, just like I mentioned about the natural flavors. I do think that carbonated beverages, whether they're sodas, which, most of us know consequences of too much soda, but the bubbly waters are an alternative these days to, you know, the sodas and feeling like you're getting something in that's a treat. But if you're hitting up 2 to 3 of those guys a day, that could also be a really big irritant to the gut. So those would be the biggies I see:
Mhm.
the dyes, the chemicals, the bubbly water. It's wild. And then, alcohol. But, a lot of people are like, "Well, I'm getting my wine from an organic farm." Okay, great. But are they putting any artificial flavors into that wine or artificial colors? So it's things to think about. It's really interesting that the grapes may be organic, but they're also messing with the flavoring agents. So you really got to know where your food's coming from, and all of the stuff that's frozen. And I'm not talking about frozen veggies, but the frozen prepared meals. I think there's a level of irritant there because you've got to heat up plastic to eat
Mm.
those foods. And now we've got fake estrogens, things of that nature, fake plastic chemicals that are going to irritate the system. So I'd also really think about what you're using to heat up your foods, what you're using to eat out of. A lot of the compostable takeout boxes and things of that nature. We've had Dr. Oz who exposed all that in terms of chemicals in those, and wondering if that's even better or not. I've started to bring my own takeout boxes if I really
Mhm.
can't finish
That's a
something.
good idea.
Yeah,
Yeah.
it's crazy. It's crazy. So those would be a lot of what I see in the office. I mean, there's a lot of obvious ones that
Yeah.
some folks can kind of think of, but when you're looking at prepared things and different chemicals, that's where the hidden stuff really comes from that can irritate the gut and
Yeah,
blood.
I'm sorry, go ahead.
You're fine. I was just saying, oh, and the blood brain barrier.
Yeah. Um, I think this is really interesting because I think, when I think of inflammation, I'm thinking of things like gluten, as we mentioned, or sugar. But never have I thought really about the natural flavorings. I have to a degree, knowing that we don't know what that means.
Mhm.
But, I have to say, I do drink some bubbly water and, more because like I like that carbonation, but that's interesting. You're making me reconsider this, especially because we don't know where those flavorings come from. And I'm not drinking anything with artificial sweeteners, but it's pretty interesting. So that will be one to consider. And also, I think that that's interesting that you're mentioning even that organic wine can have some not so natural flavorings, or we're not sure where it's being produced. So that those are things that I think are good for our listeners to think about because it's going beyond just like the obvious that we may consider. One thing you did mention was that you talked about heating up the plastics in some of those like estrogens, like those
Mhm.
exogenous estrogen or estrogen mimicking properties that we can be getting into our bodies. I had heard you on one of your podcasts say that excess estrogen, excuse me, can be a psychosis producer, which
Yeah.
I found to be very interesting. So, getting back to this neuroinflammation, can you talk to us for just a minute about hormones, like, and how that might play a role in neuroinflammation? Because a lot of our listeners are women and who are maybe middle aged or even like approaching menopause or in menopause. So, I think that's something that we may all be very interested in hearing.
Oh, yes. Yes. That is another really big part of neuroinflammation. And yeah, I didn't mention that first, but hormonal imbalance can cause a ton of imbalances within signaling of our nerves. In particular, progesterone is the hormone that calms our nerves. And
Mhm.
in the functional medicine or anyone who's working with bioidentical hormones, such as myself, we're often prescribing progesterone to help folks calm down I will often use it when someone has a ton of anger and irritability. They're snapping at the kids. They're losing, control at work when someone sets them off, and they're not sleeping. So I often will use either a bioidentical progesterone cream, a capsule, or I'm using something like Vitex, which is chasteberry or evening
Mhm.
primrose oil. I don't always use bioidentical hormones. It all kind of depends on the situation. So lack of progesterone, so progesterone deficiency and estrogen excess, can set you up for some serious emotional issues. Meaning PMS, if you're still getting your period, you might end up having PMDD, so premenstrual dysphoric disorder, meaning, for lack of a better term, you're going a little cuckoo before the period. And if
Mhm.
any husbands are listening to this right now, they're like, all you ladies are doing that. No, I mean, this is a case in which there's PMS and there's irritability, there's tearfulness and things of that nature, but there's also PMS to the 10th degree, where some ladies are cannot function due to the intense mood swings. Now, what's
Mhm.
happening there is progesterone's lower, and that happens as we age. And anybody who's perimenopausal is having fluxes of estrogen going up and down, roller coaster style. And where are we getting all this estrogen from? Well, somewhat our body's trying to figure out how much it needs, but we're also getting it from plastics, the environment, our drinking water. It's kind of disturbing how much, when I test someone's estrone, which is your inflammatory estrogen, it's E1. There's three main estrogens that we look at: estradiol, estrone, and estriol. And estrone is your inflammatory estrogen. The higher that goes, the more the nerves are unstable, because we need enough progesterone to keep those nerves happy and calm. Same thing goes with keeping the gut lining from having too much histamine release, which, for
Mhm.
those of you who are not familiar with histamine, histamine is what will cause a allergic reaction in the body. Is kind of what causes that swelling and redness, and that once you get a mosquito bite or a bee sting. But histamine is it's a neurochemical. It's a signaling message. So we want some histamine, but we don't want it kicking off all the time. And the lower our progesterone goes, the higher amounts of histamine we have circulating in the gut, and that can be another factor for degrading the gut lining and also the blood brain barrier. So in a lot of cases where folks have chronic neurological pain, complex regional pain syndrome, or pain in terms of neuropathy and it's post injury, something of that nature, I'm going to consider giving them progesterone at a higher amount for a little while, just to calm the nerves down. Same thing goes with some of my fellas. Guys can also use a little bit of progesterone if they're finding that they've got chronic nerve pain, so stabbing, burning, irritability, like, of the nerves, like angry nerves, as I've been told, in a certain body part after a surgery, after an injury, anything of that nature. So yeah, hormones can play a huge factor in neuroinflammation, and you definitely want to get a monitor of, like, how high is your estrogen, how high is your
Mhm.
estradiol, and where's your progesterone at. Best time to check for ladies is between day 19 and 23 or so of the cycle, because
Okay.
you want to get an accurate progesterone, because that's when progesterone is supposed to be at its peak. And sadly, I'm probably looking at 50% of the population in their 30s and 40s who are
Mhm.
premenopausal or perimenopausal are low in progesterone. It's just that common.
Yeah, I believe it. I'm one of those. I am tomorrow's my birthday. I'll be 45 tomorrow.
Yeah.
And I have been taking or been using bioidentical progesterone cream, and it has saved my life and my kid's
Mhm,
life
mhm,
because never in my life before I hit my probably like early 40s um did I have PMS. And and I could just tell that something was wrong, and I did some testing and did saliva testing, and
mhm,
did know that my progesterone was quite low in comparison to the estrogen. And even though my estrogen was within normal limits, my progesterone was so low. I was having all of those symptoms of excess estrogen, like you're talking about. So, one question: as we hit menopause, then does this all kind of even out, or do we still need to continue taking progesterone?
Oh, dang, I wish. I wish it evened itself out,
Mm,
and the
yeah.
world was just like a big rainbow and sunshine and everything was great. One of my professors back, I went to Bastyr University here in the north side of Seattle, and One of my professors, a Chinese professor in particular, had said something that's always stuck with me. And he said, the ladies who do better in menopause are the ones who balance their hormones in perimenopause, who get their stuff
Mm.
right in perimenopause. And we can go into perimenopause 10 years before we
Mhm.
actually hit menopause. So, all you ladies out there that have a good relationship with your moms, ask your moms when did they go into menopause so you kind of
Mhm.
know ballparky what you're looking at, because the more primed you are to go into menopause, helping your body to naturally support its hormones, the better things are going to be for you. You're not going to have that crash. You're not going to have pretty much your life turned upside down in some cases. So, things to think about: stress management. I mean, everything. It's huge in
Yeah.
the perimenopausal world. I'm 42. I'm starting to realize that things aren't looking as well. And yes,
Yeah.
progesterone is pretty much the lifesaver for a lot of us, and marriage saver, I
Mhm.
probably should.
Yes. Now we'd like to take a minute to give a shout out to our show partners, Perfect Supplements and Amazon. Perfect Supplements is a family owned and operated business that supports local farms. Their superfoods and supplements are non GMO, third party tested for purity, and contain no synthetic ingredients, colors, or flavors. They're also organic or wild harvested and fairly traded. Products range from collagen and bone broth powders to plant proteins, greens, desiccated liver, and adaptogenic herbs. Perfect also carries vitamins and supplements from other reputable sources like Just Thrive, Dr. Mercola, Gaia Herbs, Green Pastures, Garden of Life, and Prescript Assist. To check out their wide array of products, go to perfectsupplements.com/Kim. If you use coupon code KIM10 at checkout, you'll get 10% off your order. This is a great way to get superfood nutrition while helping to support our podcast. And just as a disclaimer, it's not the intention of our podcast to provide specific medical advice, but rather to provide you with information to better understand the role of dietary supplements in health. We urge you to consult with a qualified health provider to discuss both the advantages and risks of using dietary supplements. Our other show partner, Amazon, is the largest online warehouse and carries just about everything you need. If you shop on Amazon, which is likely, you can support our show at the same time at no additional cost to you. Simply use our affiliate link to enter the site, then browse and buy, just as you normally would. A Whole New You podcast will make a small commission from your purchase, which helps to support production costs for the show. You can find a clickable Amazon link in the show notes for this episode. You can also go to the products page of our website, awholenewyouPodcast.com, to find the link. If you love our show and appreciate the free information you get each week, please consider buying from Perfect or using our affiliate link when making purchases on Amazon. Now let's get back to the show. So we talked about food sensitivities. We talked about the leaky gut, the hormones. I've also heard you mention things like infections. How do those play a role in neuroinflammation?
Yeah, there's a couple different infections, and before I jump to infections, there's one thing I did
Yeah.
want to say that I think is really important, and something that I've found to be huge with my patients and myself with hormones really quickly, is
Hmm.
the amount of red meat, the amount of chicken, the amount of turkey, etc., pork, whatever your meat of choice if you're eating meat. High amounts of these animals, and when you're not getting most things are not injected with hormones these days, so we've been told. I don't know. It makes me wonder,
Yeah.
because the
Yeah.
folks who are eating more of the higher protein diets, and animal protein in particular, and keto, and milk products, cheese. Um, Keto scares me a little bit, and I'm going to say that because I see a lot of
Mhm.
people diverting to copious amounts of cheese and sour cream that
Yeah.
they normally wouldn't eat. There's a lot of estrogens coming in from those animals, and I see a
Mhm.
lot of PMS get worse when folks are very dependent on their protein sources of animal products. I'm a huge proponent of subs in some veggies. Eat your darn
Mhm.
veggies,
Yeah.
because I do feel that the hormones are some of the issue. Now that leads me into the infections, because we're eating a lot of foods that, if we're eating out a lot, we don't know really if those foods were cooked to high enough temperature per not government, what is it? The USDA standards, whoever's regulating the temperatures that foods are supposed to be cooked to. And I had a great conversation a couple podcasts ago with someone about sushi. It's
Mm.
kind of like, ooh, all the rage, sushi's great, but we're looking at sushi being a non-cooked fish. If anyone's ever lived in the Pacific Northwest or anywhere where fish is coming off the boats and you can get a hold of the fish, it's a eye-opening experience how many little worms are on the fish.
Ugh.
It's gross. I mean, I
Ugh.
even pulled stuff from really fresh fish markets, and there's little parasites and things. So
Mm.
my point about infections is that fish can carry some parasitic components to them. And I see a lot of folks that have gut issues and blood brain barrier issues, so neuroinflammation, and we come down to getting their stool tested because maybe they're not losing weight, maybe they're feeling constantly bloated, or it could be the opposite. They're losing weight, they can't figure out why they have diarrhea, and we find parasites. And
Mm.
so it's something to really think about. An infection with parasites can have a huge effect on degrading your gut lining, but not only that, degrading your blood brain barrier, because if something's living in you and irritating your lining and your beneficial bacteria can't help keep things at bay, in addition to your immune system on the gut lining, now you're going to have more molecules get across just because that parasite's sitting there. So
Mm.
there's parasites. There's also viruses. We have viruses that are taking up shop on our gut lining. So when I say gut microbiome, I think a lot of people think it's just bacteria. We have yeast, we have viruses that are in there, and we have molds. Now, yeast and mold, same category, but I like to separate them apart because a lot of people think of yeast as candida, and then they forget about aspergillus and some of the other things that could be living on your gut lining. So, infections with molds can cause a huge issue. Yeast, in terms of candida, can cause a huge issue because what these guys are doing is they're irritating the gut lining. Now, viruses such as Epstein-Barr or monovirus can also have a huge connection to the nerves. Viruses such as a herpes virus, which mono is in the herpes virus category, but there are herpes virus 6 and herpes virus 8. Interestingly enough, these two guys, I will pull the herpes virus panel on folks, and 6 and 8 seem to have a connection with chronic nerve pain, neuropathy, stinging, burning, aching, tingling kind of sensations that folks can't seem to kick. One of my main things in my practice and why I love it, neuroinflammation, is because I'm an acupuncturist. I love to work with pain. And so figuring out which particular viruses folks have and trying to work on eradicating them can also get rid of pain. So if anyone's out there trying to figure out, like, okay, I've had pain for so many years, no one can figure it out. I've been a PT, I've been to surgeons, they say I don't need surgery, they tell me it's all in my head. It's not in your head, it might be in your gut or your bloodstream or even in your spinal cord, because
Mm.
herpes lives in the spinal cord. It lays there dormant, hanging out. So having a panel to look and see what herpes viruses you might have, if you have monovirus, if you have something called cytomegalovirus, checking to see if these viruses are lurking. These are big deals. And parasites, same thing. So I highly recommend folks looking at secondary infections. Lyme is another biggie. I think for a lot of people, we connect Lyme with neurological symptoms. So that one's
Mhm.
kind of, a no-brainer. But a lot of the herpes viruses and mono, I think a lot of folks don't really know about that. So asking your docs to run these panels to see if there's anything lurking that they might be, you might be harboring and might need some help.
So, you're a naturopathic functional medicine doctor, and
Yeah.
for those of our listeners who don't see one, would you because I feel like mainstream medicine doesn't test for things like that. So, would you recommend someone see a functional medicine doctor if they're having symptoms?
I think it's highly advised. I'll be honest,
Hmm.
there's a lot of medical doctors out there who are becoming savvy, and
Hmm.
there's some that aren't. And I don't want to knock them. It's more that,
Right.
depending on what you're into, what you like geeking out on. I would, if your primary doc is up for ordering stuff to help you figure things out, just it doesn't hurt to ask. And that's the part of empowering that I love to work with my patients. It does not hurt to ask. If they say no, you're like, okay, then I know I've got to go somewhere else.
Yes.
Because
Right.
I've been told many times in working with a lot of conventional docs in my past that, if you don't run it, you don't have to manage it. Because if you don't run
Mm.
the lab and nothing, you don't have the ability for anything to come back, that you have to figure out what to do with.
Right.
That's
Right. So,
disturbing. That, made me want to cry. And so, yes, if you ask your primary care doc, the thing about it is you got to go through podcasts and things in that nature to know exactly what to order. And I can give you a list. I'll email you a list of things you can put in your podcast notes for folks to ask
okay.
in particular, because they're long-winded panels. But if you're in a situation where you've got naturopathic doctors or functional medicine doctors. So these are folks who are certified by the A4M or IFM, which is Institute for Functional Medicine. You want to get someone that's had a certification, because there's a lot of people out there right now saying that they're functional medicine docs, and they're not 100%. And what I'm saying is medical doctors saying that they're functional medicine.
Mhm.
Naturopaths, we're trained this way out the gates. I don't have a
Mhm.
certificate of A4M or IFM, but it's because I was trained to look at this stuff.
Yeah.
So that's one thing to distinguish with naturopaths. So if you have the ability to find a functional medicine MD that's been certified, that's the way I would look first. The second thing I would look for is a naturopath in your area. And so our website for searching for naturopaths is naturopathic.org. naturopathic.org. It's the American Association of Naturopathic Doctors. And so you can search that site to find if you have someone in your area. And then scour their websites and see what they're into. One of the things that I like to kind of clarify on all podcasts is that functional medicine is what naturopaths were trained in the first place. And a lot of
Mhm.
us will go by, the title of functional medicine docs because it's more of the mainstream term. But all naturopaths have a basis in functional medicine, and especially the docs who are newer coming out. A lot of our older folks who are in their 30 plus years of practice were heavily with nutrition and herbs. But if folks have kept up on their training, we have that inspector gadget training
Mhm.
ingrained in us to figure out what the heck is causing the problem. So there you have it in terms of folks looking to find somebody in this industry.
Yeah, it seems pretty complicated just because if you're having any of these symptoms, and again, just to reiterate, it's that you can have things like nerve tingling and weird
Mhm.
sensations, but it can also be anxiety and anger and irritability and even migraines. Isn't that
Oh,
a symptom as well? Um,
absolutely.
so there are so very many things that could be causing it. So getting to the root cause is so important, and working with a naturopathic doctor is probably your go-to thing to do because they can help you get to the root cause. So, if someone before they find a doctor, would you suggest them like at home? What are some things they could do? Would you suggest keeping a food diary or
Yeah.
tracing back infections, or what would you suggest someone do before they even see a doctor?
If you've listened to any of my other podcasts, it's always
Mhm.
journal, 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 and you're right about a food
Mm.
diary.
Mhm.
The more
Mhm.
data that you can bring into your doc out of the gates, the more processing they're going to have for you and more ideas for you, because you're your best investigator. We're just kind of a secondary individual taking a look at what's going on. But if you can connect the tingling, irritability to some time in your period cycle. Okay, note that. If you can connect it to food, okay, note that. So, doing a daily journal of breakfast, lunch, dinner, what you drank, your moods, your energy levels. Because another sign that I overlooked, and it's one of the most simple ones in terms of things that happen to folks, I guess you could say are most common. Simple is not, that is not associated with this word, but fatigue.
Mhm.
Figuring out
Mm.
fatigue is not simple, but what it is
Mhm.
common. Fatigue is common. So I highly recommend, like, step one for a lot of folks, and I love it when people come in with spreadsheets in my office. And I know it sounds
Mhm.
weird, I'm a geek. If you bring a spreadsheet in and you've tracked what you drank, what you ate, what symptoms you had, and when they showed up for you, I'm going to be a lot more likely to be able to pinpoint what's going on. Because, for example, let's give you an example from a patient in my office that I just saw early last week. She goes, hey, my symptoms are every 4 days, I tend to have a flare in symptoms. And it was her skin in particular. So when I'm talking about symptoms, I'm talking anything. You get a pimple, note it. You get a rash, note it. You feel like your lymph nodes are swollen, note it. This patient in particular was having a rash every 4 days on her face, around her mouth, around her ears. Well, that's a parasite cycle because parasites
Mm,
will rage every 4 days. So we can connect this information if you spend the time. And I know a lot of people are like, oh, I don't have time to chart this stuff. At the end of the day, everybody's got 2 minutes to just write down what happened in their day and what they remember. And if you're one of those folks that has brain fog and you're not so good at remembering, okay, maybe you need to do a little information throughout the day. You can record notes on your phone in 30 seconds.
yeah.
So it's not that hard to do, but that's my first thing that I would recommend anybody doing is just take some notes and just start to get to know your body better because your body's going to give you every single signal and every single clue. And then once you start to put it together, you might even figure it out yourself in terms of, oh, this is the pattern. Then take those patterns to a functional medicine doc or a naturopath and then say, this is what I'm finding, help me figure out what the cause is. The more data, the better.
Yeah. That's just wise, and I think, it like you said, it doesn't take long, but I can't remember what I had even, like, for lunch yesterday, so, I mean, you have to write it down because you won't remember. You won't be able to connect the dots a few days afterwards, so just kind of trying to do that, and that's really interesting about parasite cycles.
Yeah.
I mean, that's something that we wouldn't know, as laymen, we wouldn't know that that might be the cause of some symptoms. So it really is important to see a doctor. Now, when we do come in for treatment, if we're having these symptoms, I know it depends on the root cause, but what are some of the treatment protocols you might suggest for people? So that could be anything from like supplements, or we already talked about diet and things to avoid. But can you maybe talk to us about some of the treatment protocols? So I'm wondering about like supplements that might be useful, in addition to progesterone that you mentioned for those who have estrogen dominance. And then also I'm curious, because viruses can lay dormant, like what are some things you do to treat viruses that people may have had for years and years?
Okay. Yeah, let's start with what I do first with folks because no matter what is going on, we need to figure out a way to help heal up someone's gut lining. And like
Mm,
I said, it's not a one size fits all, it's a one size fits one type of treatment. And typically, I'm going to give an agent like L-glutamine to folks. Now, I wouldn't give L-glutamine's amino acid, by the way. It's
mhm,
one of the most simple amino acids out there with one caveat. If someone struggles from excess glutamate in their brain, and this is something that you can kind of assess in terms of how much anger, how much irritability, you don't want to use L-glutamine. If someone's already on gabapentin, which is a pharmaceutical medication commonly given for neuropathy symptoms, you do not want to give L-glutamine. But L-glutamine is one of my favorites for working with gut lining healing, as is collagen. So if
mm,
someone is struggling and they've got a lot of gabapentin on board because their medical doc was like, I don't know what to do. I'm just going to give you a bunch of gabapentin and shut down your nerves. Well, nerve excitability, let's put it that way. Um,
mhm,
it's it's the go-to in terms of collagen. I'm going to give them collagen, and it can come in the form of bone broth. It can come in the form of powdered collagen. Obviously, you want to get a very good source. Keep in mind, collagen is you want it coming from an organic source.
mhm,
So that's usually the gut lining for number one, working on integrity. Number two is working on your microbiome. So finding out a certain probiotics that's going to fit with this person. Because most of the time I'm going to do some stool testing, such as Viome, or I'm going to do something more advanced, such as Doctor's Data 360 or GI mapping or something of that nature. And I'm going to look at how can I help reestablish this person's gut microbiome. That means we're going to give extra veggies, lots of fiber, because probiotics, all the beneficial bacteria in the gut love fiber, love it. So I'm going to tell folks you got to eat more veggies. And we got to figure out how to make it more digestible for a lot of folks. Raw veggies are hard on your gut. cold foods are hard on your gut, that's 5,000 years of Chinese dietary therapy right there.
Mhm.
So folks who are eating raw foods, the only way that I think folks should be eating copious amounts of raw foods is if it's 100 degrees out and it's warm, it's summer, or if you're living somewhere that's tropical like that, sure, you could hit up your raw foods. But if you're living in the, for the lack of a better term, most of the North America regions, it's going to be cold a lot of the year. So keeping in mind what's going in your gut. So, warm foods, veggies, gut lining repair. Definitely going to think about food sensitivities because I believe that food sensitivities can really affect your gut lining. I think that they can also be a direct response of what beneficial bacteria you have or don't have. So, there's a huge connection there. So, that goes back to journaling, making sure you know what you don't get along with, and then countering that to kind of confirm or deny which foods that you
Mhm.
have irritation or issues with. In terms of other supplements, I do like prebiotics, but I like to use it in the form of foods. So that would be boiling fingerling potatoes, apples. Those are great for prebiotic fiber in addition to the fiber that you would get from regular veggies. In terms of beyond that, what do I do for the brain inflammation? It depends on the person and what's
Mhm.
going on, but taurine can be extremely beneficial to get things in and out of the brain if you want to get vitamin B6 there to help with depression or 5-HTP, those kind of things. Taurine is a good shuttler for that. Not everybody can tolerate taurine if they have a sulfur intolerance, so something to think about there if someone suspects that they
Okay.
can't tolerate sulfur. So if you have sulfur drug allergies. So
Yeah.
there's that. And then in terms of viruses, viruses are tricky. Oh, they're the bane
Mhm.
of my existence.
Mhm.
And really, when we think of viruses, we need to think of it as we're not eradicating them per se. We're knocking them down to a less than detectable level. It's
Mhm.
a lot of them you're not going to fully get rid of. Herpes virus is going to stay in your body for life, any
Mhm.
of them. And so, same thing with human papilloma virus. So, this is the warts virus. So,
Mhm.
my favorite herbs for killing viruses. Okay, hold on, folks. Get your pens. Okay. Hold on tight. So, monolaurin is number one on the list. Lauricidin is the actual product that I often will use. It's a powder. When people start taking it, they tend not to feel too great because when you're killing a virus, you're going to tend to feel like you're fighting a virus. So, keep that
Mm.
in mind, always that caveat. So, lauricidin being the product, or monolaurin being the actual molecule, those guys are number one. Oftentimes, I will add in a product by Herb Farm called Viratac. This is something else that it's kind of funny. I noticed that the medical medium, if you guys have heard of him, he uses that product as
Mhm.
well.
Mm.
I use a lot of Laria odentata, which is an herb that's very, very strong to kill viruses. Chaparral, in terms of its common name. I will use pretty much any form of cycling of artemisinin, which is sweet wormwood. It also works on parasites as well. And so those are kind of like my biggies for virus attacks. We would be here all day if I gave you my full list. In terms of
Yeah.
parasites, cycling artemisinin, cycling myrrh, cycling the herb black walnut, also cycling in cloves. So you can use clove, by the way, clove oil. A lot of folks are into essential oils. If you've got an
Mhm.
for oil, use clove. You can use pumpkin seeds as well. Sprouted pumpkin seeds are really nice and digestible. Grind those suckers up so you don't even have to chew them because most people don't chew enough. Those would be another antiparasitic way to look at things. And then looking at general health and just kind of the gut lining, I like to use silver. So,
Mm.
nano silver is one of my favorite kind of broad spectrum wiper outers of sorts, kind of cleaning the slate. That's probably the best term because you're not going to officially wipe out everything with silver, but it's going to get a lot of the stuff that's stuck to the lining. If anyone's heard the term biofilms, silver is
Mhm.
great for that. And acetylcysteine is also great for that. So those two I'll sometimes consider. And acetylcysteine also boosts your natural glutathione. Glutathione is your body's janitor. It kills viruses and bugs. So that's kind of a little sample of the most common things that I find as the most effective. And keep in mind that, it's not a one size fits all, but those of you out there that are hearing these things, if you're struggling with any of these issues, bring these herbs or supplements up to your providers and say, hey, do you think this is a fit for me?
And I think that's good advice. We're not suggesting that people go on to Amazon and purchase a bunch of supplements without knowing what they have, right?
Please don't do that.
Yeah. Yeah, we definitely want to make that disclaimer because I think sometimes we may think that something's going on, but we can actually do more damage to ourselves when we're self prescribing
Oh,
uh,
yeah.
herbs and supplements. So, okay. So very good point. Well, that's very helpful for people to know that they can, when they go to visit their doctor, they can come armed with a food diary, some suggestions for, supplements, and knowing what to look for as far as having, blood work done or testing for certain things like food sensitivities or viruses. So we've talked about the whole gamut of things. I so appreciate you because I think you have brought this important topic of neuroinflammation to the forefront. I think I understand it better. And I think that it's something that we can all learn from because probably to one degree or another, we all suffer from some form of it. But it can be debilitating for some.
Mm-hmm.
So I really appreciate you being here today, Dr. Krause. How can people find you and connect with you?
Yeah, the best way to find me is on my website, doctorjakraussend at .com. I was just giving you my email. Y'all can email. Oh my
Okay,
goodness. So
great.
drjkraussend.com, the healthfixpodcast.com as well to check out my podcast. And on Instagram, you get my personality, you get me being me, silly, giving
Mhm,
little tidbits,
mhm.
little value bombs there. So check me out on Instagram, Dr. Jannine, Jannine, Krause, Krause, all smashed together. And that's where I live most of the time.
Awesome. Thank you so much for taking time to be with us today. We appreciate it.
No problem. My pleasure. Thank you.
That's it for today. For more from Kim, you can go to kimmaravich.com. For more from Lori, go to simplyempoweredllc.com. We're always open to listener questions or suggestions for the show. You can email those to contact@awholenewyou.podcast.com. We'd also love it if you joined our Facebook community and followed us on Instagram. Just search for A Whole New You podcast. And lastly, if you'd be so kind as to leave us a rating and review in iTunes, we would really appreciate that so more people can find our show and join our community. We'll see you next week.